I am Dr. Thompson Akwo Ntuba, international physician, certified professional and expert in global health, USA, international politician and communicator, subspecialty medical and health communication, what we call medcoms or global health communication. COVID-19 updates. Africa, Cameroon. COVID-19 updates. Africa, Cameroon. A call for the Cameroon Bar Association to reason with COVID-19 public health and global health authorities in Cameroon. With our work with the authorities in the United States and with my travel to almost all the 50 states in the USA, with my work with the city of Houston, the state of Texas, and other states in America, with my work with Dr. Larissa Etienne, the Director General of PAHO, the Pan-American Health Organization, which is the representative WHO regional office for the Americas, because PAHO was there before the WHO was ever initiated and began. So it just transitioned and stood as the regional body for the World Health Organization for the Americas. So that's why it is called PAHO, and people are surprised why it is not, there is no WHO in quote in the Americas. There is WHO in the Americas. And the Americas are made up of North America. We have Canada, the USA, and Mexico, and then South America, all those countries, Argentina, Brazil, Chile, I name them. And so PAHO regional office is in Washington, D.C., and is led by the Director General, Dr. Larissa Etienne. So we've been working with them, holding these meetings on COVID-19 preparedness and response in the Americas. The same with Europe, Asia, and some of the other continents and Africa. Even though we've not done too much with Dr. Mwete, who is the Director General of the Africas, the office in Africa, we are aware of the fact that a lot of the input from Africa plays out at the Global World Health Organization body in Geneva. That is headed and directed by an African from Ethiopia, Dr. Tedros, and that's the first African to lead the World Health Organization out of Geneva. So for almost 2 years, we've been having bi-weekly meetings with Dr. Brian, Dr. Tedros, and the ministers of the different nations and governments who represent their country. You're aware of the fact that in May we had the World Health Assembly that was predominantly looking at COVID-19 presentations from ministers and governmental representatives from the different member states, and Cameroon was also represented among other African countries in the different blocs and groups that they belong. And I have inside information with I work with Anthony Fauci and the national level, the Global Health Summit at the level of G7, and then the other summits at G20 and all the other meetings which are going on, and the extensive further training that we've had from the World Health Organization and the certifications that go with them. I was looking at the certificates the other day, and I think I have about 8 of them. But that notwithstanding, I want to sound this wise call and a call for reason and caution to the authorities in Africa, Cameroon. The Bar Association and their leadership is actually speaking against what the government of Cameroon is saying and doing. They are talks here and there about the possibility of the government of Cameroon putting mandates for vaccinations against COVID-19, if need be, because apparently it looks like they got the vaccines, but there is vaccine hesitancy from the population. It is even said that the people in the healthcare personnel are refusing to take the vaccine. First, when I began to follow what is coming out of Cameroon, I had certain suspicions and doubts and questions as a global health expert, and part of our global health work is in the area of immunology and vaccination. We are aware that while the WHO has the guidelines for member states, every country is responsible for the vaccination of its nationals, and therefore they have what is called their national vaccination policies. And right inside those national vaccination policies, whether they are expanded program of immunization or they are special immunization programs like we have COVID today, they are actually specific. We take the specificity of regions and also country. There are some things which are very specific to PAHO. There are things which are very specific to Africa. We are also aware of the fact that we've been talking about or against vaccine nationalism in the West and the rich countries of the world. We know that the Serum Institute of India had to deal with huge surges of COVID cases and hospitalizations and death in India. So they had restricted the exporting of vaccines from the Serum Institute. But all of that is being reviewed with changes, with positive outcomes, which we are experiencing around the world, especially in the West, in America, and in Europe. So we see that Canada is already agreeing with the United States to open its borders, because Canada was in front to say that we are actually doing well in terms of managing the problem, and the people of the United States are not having very good outcomes. So Prime Minister Trudeau was actually one of those among the two who was constantly saying that the borders will not be open for now. We're going to review that. I think so far President Biden has been doing a lot and things are changing. So apparently the borders between the United States and America are set to be going into operation exchange, by the nationals of both countries. And I think the same with COVID. Now, a free Cameroon is already preparing to host Africa and the world, football-loving nations, and nationals, and coaches, and football teams, and professional football leagues overseas are sending their people to Africa to observe the games and to see who is playing what and how. Because, even sports today, soccer is a globalized thing, and a lot of people overseas recruit some of their players from overseas, and that doesn't exclude Cameroon. So Cameroon is working with the World Health Organization and the regional African health body, or the WHO, to make sure that sporting events of that size and the type of populations that you may have in the stadia goes with the guidelines and requirements of the World Health Organization. You know that the Japanese didn't have spectators in the Olympic arenas because of COVID. So that was a mandate. That was a mandate from the government, even though there are people who said, oh no, let the country actually even suspend the games. But the Japanese said, no, we are going to put certain mandates in place. We are going to restrict certain actions, by the population, and restrict the people who can get into the stadium. So far, we have not had any problem after they hosted the Olympics. So the Cameroonian authorities are talking, about working with the authorities and putting, the preventive and protection barrier measures in place, and evaluating and studying some of the logistics issues and all of that. We should not be talking against COVID vaccination. We want to first thank our lawyers and members of the bar of the Cameroons for participating in the control and prevention of SARS-CoV-2 and COVID-19. We also want to commend them for encouraging their members, their lawyers, be they lawyers of the private bar, of the government bar, who are called the state prosecutors, to be involved in COVID-19 prevention measures and making sure that one of the major tools that we have in our tool box, the COVID vaccines, are taking. There is the talk that the Prime Minister of the Cameroons, Dr. Diongute, had spoken on behalf of the Cameroons that there will be no mandates and that the people will voluntarily take the vaccines. But let me make it very clear that, because this has been an evolving problem, yesterday in the United States, one thing was said, and the next day, something else is being said after there is science-based evidence, to motivate the new actions and new instruments and policies to be put in place. The same thing is happening in the Cameroons. Some things were said before which were correct, as people thought, vis-a-vis what was on the ground as of the time. Some of those things will be reviewed by the authorities in place, working with the Cameroon Medical Council and the Association of Medics and Paramedics and laboratory scientists and all those who are involved in healthcare. Through their leadership, they are going to make their opinions known, because the control, the national control, is Cameroon's national control. It's not America's national control. America doesn't dictate to Cameroon. Cameroon is not the state of America. It's not a French control. France does not dictate to Cameroon. Cameroon is not an extension or a province of France. It is Cameroon's vaccination program. So, yes, the Bar Association says that Cameroonians are saying that they must not be mandated. They must not be forced to take the vaccines. We are aware of the fact